Jackie. So in this room we have Maria Rodriguez. She is here with acute exacerbation of asthma. She's been waking up coughing. A little bit of her history is that she hasn't been to a doctor in 10 years, no surgeries, does not smoke, is a social drinker.
Okay.
She states that she doesn't read well, but I'm not seeing that. Everything that we've given her, she's been able to read and understand.
Okay.
And she, in fact, was the one that reported that her peak flow had dropped 50 in the last few days. So I feel like she's underestimating her skill. And I did her assessment this morning. She was alert and oriented ×3. Blood pressure was 120/60. Heart rate was 80 and respirations were 22. She does have some wheezing upon expiration when you're listening to her lung sounds. She's been sexually active since 15. She does take birth control. She currently has a partner, and she's had asthma since she was 4. So real long time. She is not always able to get her meds because of money. She works at McDonald's, and that's a real big concern, the lack of funds and concern that she's going to become ill and not be able to return to work. Skin intact and dry. She does have a white coating on her tongue, so I'm wondering if that isn't from one of her inhalers, and maybe she needs a little more instruction on using that.
Yeah, I'll kind of go over the inhalers with her, make sure she understands how to properly use them.
Okay. She is supposed to be discharged today,
Okay.
so hopefully that happens for her. I know she's looking forward to it. Other than that, any questions for me?
Do we have a consult for the case manager on getting her some resources for the community?
Yes. Manager is going to check into that for us too, so that we can resolve that issue for her.
Okay. And then any knowledge about change in meds, or have we not gotten that yet?
We've not gotten the doctor's order yet, but my understanding is that there will be some change in meds when she goes home.
Okay. Sounds good. Well, hope you have a good rest of your day.
Alrighty, thanks. You too. Hope you have a good shift.
Hello, Maria? Yes. Hi, my name is Kara. I am a case manager here at the hospital. I was called to do a consult for you to give you some more information for some things that you needed. Who do we have here?
This is my brother Miguel.
Hi, Miguel. Nice to meet you. Is it okay if we all talk?
Absolutely. Wonderful. All right, I'm gonna have some here.
So the reason why I was called is because usually when patients have a hard time, with resources, things like that, they call case management. We come in, we give you those options, give you the ways that way you can get what you need after you leave. Top of the list for us, insurance. Do you have insurance?
No, I do not.
Okay. So I have some information here for the Department of Health and Human Services. You can either go on their website online or go directly to one of their locations listed in this pamphlet here.
Okay.
They are able to work with you. I don't know exactly what you need because it's all in here for you, specifically of what they'll need from you. But you can go ahead and either set up an appointment to go there or do that online. That way you can get some state insurance offered to you.
Okay.
All right. Once you have that taken care of, you can go on the back of your insurance card. You can look for a primary care physician that is offered through the insurance there, or you could also go to one of these free clinics that I have here as well. If you need to go sooner before your insurance is set up, these places don't require you to have insurance. I have a couple different locations here. You could go to the CAS clinic, which is in Detroit. I'm not sure locally where is more convenient for you. But they have some different hours on the weekends. If weekdays don't work best for you, they offer free medical exams, free services for all patients. They also offer some prescriptions for free as well. They also have the Hope Clinic, which is also in downtown Detroit. They also have a Wayne Clinic and a Ypsilanti Clinic, and they're open Monday through Fridays, different times, and some Saturday hours as well.
Okay.
They offer some dental, vision. They have a food pantry, laundry. What are your religious beliefs? Do you have any?
No.
Not really?
Not
Okay.
specific.
That's okay. Well, if you don't mind them, they offer prayer groups, some behavioral health issues, different things, groceries, baby services, if that's something that is needed. And then I also have the Hope Clinic, which is also based out of Detroit as well. They do the same thing, same type of services. So it gives you a little bit of variety of hours, different places that you could go, speak with a physician, get an examination, get those medications that you needed. They're probably going to plan on having you get some vaccinations, make sure those are up to date, especially with your asthma, that's really important. The CAS Clinic and the Detroit Clinic also offer those vaccines. You could also go to the health department. They also offer vaccines. or even local pharmacies sometimes. That insurance might be little or no cost to you. But there's also a website, if you have a computer right now, so you have a smartphone.
Yeah.
Okay, GoodRx, that's an app you can download right on your phone. You could go on the website, print out coupons, look up your medications, and print those coupons, so that way you can get that discounted rate before you obtain that insurance, or it can be also applied after you have the insurance too. So,
Okay.
you might not even have a copay after that. And then I noticed in the chart it said that your brother smokes, is that correct?
Yes, he does.
Okay. He smokes inside the home?
Yes.
Okay. Well, I do have some paperwork here as well for some smoking cessation. It is definitely important to make sure that you are smoking, outside of the house, maybe not in the car, just because that will, exacerbate what's going on and kind of cause that to flare up and maybe put you right back here.
Yeah.
So, ways to prevent that, Jackie can go over and explain more in detail, but there are some resources here, also to GoodRx, all those locations that we went over. I'm not sure if he as well doesn't have insurance, but that'd be something that maybe you both could consider applying for. That way, if you would like to quit smoking, you could, or just to better for the health of your sister.
Yeah.
Any other questions or anything that I can go over with either one of you right now?
No, I think you gave me a lot of good things for us to look at, and
Yeah, awesome. Well, I have written my number here. If you have any questions, they can always page me back in to have another conversation. But it was very lovely meeting the both of you, and I hope you feel better.
Thank you so much.
You're welcome.
Hello, pharmacist. This is Jackie calling from 4 West on our patient Maria Rodriguez. I was just looking to get some information about her medications that she's going to be taking.
Okay, we're going to be discussing some of the medication that Maria is on and how it's pertinent to her. First, we have the fluticasone salmeterol, aka Advair Discus. It is a maintenance inhaler to make sure that she achieves her respiratory goals. Some of the side effects is headache, nausea, vomiting, thrush, ongoing cold or flu-like symptoms, and coughing. More pertinent to her, side effects can be wheezing, chest pain, irregular heart rate, and dry mouth. It interacts with the albuterol HFA, and the food she needs to make sure that she doesn't eat is going to be dairy products. So the next medication we're going to be talking about is albuterol. It is a rescue inhaler. It is used to prevent asthma attacks. This can be used to restore her respiratory goals. It is a aldrinic bronchodilator. The side effects include chest pain, pounding heartbeat, dizziness, upset stomach, painful urination, shaky, nervous, cold-like symptoms. Some of the adverse reactions is going to be an increased heart rate, choking, heart flutter, severe headache, high blood sugar, and low potassium. Interactions are going to be any inhaled medications or bronchodilators, diuretics, antidepressants, beta blockers, MAOIs. There is no food interactions with this medication. The next medication we're going to be talking about is montelukast, other known as Singular. It is used to prevent allergy responses from environmental stimuli such as pollen. It is a leukotriene modifier, and the side effects include stomach pain, diarrhea, fever, flu-like symptoms, headache, and common cold-like symptoms. The adverse reactions is going to be irritability, aggression, anxiety, depression, stuttering, tremors, suicidal thoughts, sleep disturbances, and compulsive behaviors. There is no drug interactions with this medication, nor is there any food interactions. So the next medication we're going to be talking about is azithromycin, other known as Zithromax. It is a macrolide antibiotic. It is used to treat bacterial infections. The side effects include diarrhea, nausea, vomiting, and headache. Adverse reactions is going to be severe stomach pain, pounding, beating heart, shortness of breath, and sudden dizziness. Drug interactions include albuterol and Advair, and there is no food interactions. Our last medication for this patient, it is going to be methylprednisolone, other known as Medrol. It is a glucocorticoid, and it is used to treat inflammation in the body. The side effects are going to be fluid retention, dizziness, and stomach discomfort. Adverse reactions are going to be shortness of breath, blurred vision, rapid weight gain, and depression. Some of the drug interactions is going to be albuterol, singular, and aspirin, and the food interaction is going to be grapefruit juice.
Hi, Maria.
Yes.
Hi, my name's Jackie. I'm going to be discharging you today.
Hi.
Can I take a look at your wristband?
Sure.
All right, and can you just verify your name and date of birth for me?
Maria Rodriguez, 8/16/92.
Okay, and who do we have with us today?
This is my brother Miguel.
Hi, Miguel. Is it okay if I take a seat?
Yes.
All right. And is it okay if I talk to you about your discharge in front of him?
Yes.
Okay. So we're going to get started on a couple things. First thing I noticed was that you have an inhaler at home. Is that correct?
Yes.
Okay. So I brought in a little training inhaler in here. And I was just wondering, can you show me how you use your inhaler?
Sure. So it's usually in a drawer, and when I need it, I just take it out. I shake it probably one time, and then I just puff in and let it go within probably a second or two.
Okay. And how long have you had your inhaler for?
I've had it for a long time.
Okay.
Yeah.
Did anyone teach you how to use your inhaler when you got it?
Yeah, they taught me, but it was a long time ago, so am I doing something wrong?
So I just wanted to go over the proper way to use your inhaler so you get the best effects out of it, the recommended way of using it.
Okay.
So keeping it in your drawer is perfectly fine because you want to keep it away from excessive heat or moisture because that can affect the medication inside the inhaler. But as far as when you're using your inhaler, the shaking part you got right. Just make sure you shake it vigorously.
Okay.
Want to make sure that you get everything mixed up inside of the canister. Then you're going to exhale. Generally people say, rule of thumb, 3 to 5 seconds that you're exhaling. Then your wet cap comes off and exposes your mouthpiece here. That's going to go into your mouth. Make sure you put your lips all the way up to the base here on the canister.
Okay.
And then make sure you're wrapping your lips around the mouthpiece there.
Okay.
When you insert your medication, you're pushed straight down, and while you're doing the inhale, and then hold it for about 10 seconds, or as long as you can if you can't hold it for 10 seconds before exhaling.
Okay.
All right? And then keep it in your drawer, like I said, is fine.
Okay.
So keep using your inhaler as it's prescribed. I know they said that you were having issues as far as getting your medications.
Yes.
Okay. I know case management was supposed to come in and talk to you. Did they give you some resources?
Yeah, they did. They did.
Okay. So next thing on your discharge paperwork here, doctor wants you to follow up with a doctor in 1 week. Is information for that also included in there?
Yes. Yep.
Okay. So make sure that you're going to the clinics and also to get those vaccines, the pneumonia vaccine and the flu vaccine.
Yes.
Okay. The doctor did add on 2 medications for you that you weren't on before. The first one here is azithromycin. That's an antibiotic that they have for you because that white coating on your tongue, that's from your inhaler more than likely. So make sure when you're using your inhaler that you're rinsing your mouth out after.
Oh, okay.
Okay. The other thing with that being an antibiotic, the birth control that you're taking, make sure you keep taking it, but if you are sexually active while you're taking these medications, that you're using a backup method such as condoms because it can affect the birth control that you're taking.
Okay.
Okay? Other new medication we have is methylprednisone. That's a steroid that'll help move things along for you and get you feeling better.
Okay.
Both of the medications that are new to you are going to have specific instructions on how to take them. So make sure that you're following those instructions and taking the full courses of both medications.
Okay.
Other thing that we wanted to talk to you about is the fact that your brother smokes. And I heard from case management as well as the nurse you had yesterday that he's smoking in the house with you.
Yes.
Okay, so Miguel, it's the best practice for you to make sure you're outside if you're smoking, not smoking around your sister because that can cause her to have additional problems with her asthma. They also were talking about giving you some information about stopping smoking. Did they give you that information?
Yes, they did.
Okay, so make sure you look that over and then take that into consideration. Is there any questions that you had for me as far as any of your new medications or any of the next steps here?
No, the only thing is I know you mentioned smoking being an issue at home. Is there anything else that it could be causing this to be a problem?
So the cold air can cause you problems with it being winter. Make sure that you have a scarf on. You can cover your mouth with the scarf when you're outside if it's windy. Exercise can cause you to have a problem, as well as, do you have pets at home?
No.
Okay. Because pet hair, if you're around anyone that has pets, the pet hair can cause an irritation to you. As well as make sure when you're cleaning that you have a window open and a fan going. Keep that circulation going.
Oh, okay. Okay.
Another thing you can do when you're taking a shower is have a fan going if you have one in your bathroom, or open the window, because that extra moisture in the air can cause mold.
Okay.
And mold is a big issue with asthma as well.
Okay.
Okay?
Mhm.
And is there anything else I can talk to you about?
No, I think that's it.
All right, Miguel, do you have any questions? No? Okay. Well, we'll get you out of here, and hope you feel better, and take care of yourself, okay?
Thank you so much.
Hi, Maria.
Hi.
I see brother left. Is he going to get the car?
Yes.
I just have a couple extra things here for you, just some information on asthma. I'm sure you know a lot about it from having it your whole life so far, but more information helps. If you could just go through before you go the stuff you learned from us today, just want to make sure that we're on the same page.
Yeah. So I'm to follow up with the doctor within a week
Mhm.
and make sure I get 2 vaccines, the flu and the pneumonia.
Okay.
I do know that I am to use a backup birth control method so that I do not get pregnant, and that I have other resources that were provided to me so that I can get some insurance for me and my brother. And then you did go over how to use an inhaler properly.
So can you go ahead and demonstrate to me how we went through that earlier?
Sure. So I need to keep it in a cool, dark place where I normally keep it in a drawer. And when I need it, I need to shake it really hard
Mm-hmm.
and take off the cap and exhale. And then put my mouth all the way around it like a seal and take a puff and then hold it in for about 10 seconds or as long as I can, and then release.
Good job. And I also, in the paperwork that I gave you, included an extra chart for you to keep track of your peak flow in case you're running low on that.
Okay, thank you.
Other thing too, your new medications, just make sure you're taking those the full course, okay?
Okay.
And is there anything else that you have questions about or concerns?
No, I do not.
All right, we'll walk you out then.
Okay, thank you.